Nearly half of all American adults have high blood pressure, and 75% of them are on medication to control it. But here is the part that should alarm every single one of them. Every year, over 675,000 Americans die from hypertension-related complications, despite taking their pills faithfully, despite following their doctor's orders, despite showing up for their refills and swallowing those tablets every single morning without fail. The pills are not solving the problem. They are managing a number on a screen, while the actual disease continues to progress underneath. I have spent years working with cardiovascular patients, and I can tell you exactly why these medications fail for so many people. Because what you have been told about high blood pressure is fundamentally incomplete. You have been told that hypertension is essentially a plumbing problem, too much fluid volume in your circulatory system. Your physician tells you to cut back on sodium, take a diuretic to remove excess water, and your blood pressure readings drop. The fluid volume decreases, the numbers improve, problem solved. Except the problem is not solved at all. That entire framework is outdated medical thinking from half a century ago. It is incomplete, it is misleading, and it is keeping millions of people sick, despite having controlled numbers on their monitors. The reality is far more complex and far more empowering once you understand it. Hypertension is not a plumbing problem about fluid volume. It is about the pipes themselves. Your arteries are not simply overfilled. They are damaged, deteriorating, and rigid. They have undergone structural changes at the cellular level that no prescription medication currently available can repair. Medications manipulate the pressure reading on your monitor, but they do not fix the underlying structural damage that is causing the pressure to be elevated in the first place. My name is Dr. Michael Williams, and by the end of this video, you will understand the 4 hidden mechanisms that actually create hypertension and the complete 4-step protocol to address this damage at the structural level. This is not about fear. This is not about throwing away your medication. This is about understanding what is actually broken inside your vascular system and what the research says can be done to repair it. Let us begin with the first mechanism, because this is where most of the damage starts and where most of the misunderstanding lives. It is called Glycocalyx destruction and endothelial damage. Your arteries are extraordinarily complex living structures composed of 3 distinct layers. The innermost layer, the surface that directly contacts your flowing blood, is called the endothelium. It is a single layer of cells, thinner than tissue paper, that lines every blood vessel throughout your entire body. This layer is not merely a physical barrier. It is an active metabolic organ that produces chemical signals controlling blood flow, preventing inappropriate clotting, regulating inflammation, and maintaining vessel health every second of every day. The endothelium itself has a protective coating, a microscopic layer called the glycocalyx. Think of it like a non-stick coating on the interior surface of your arteries. This coating is constructed from sugar molecules and proteins, only a few micrometers thick, invisible to the naked eye, but it is one of the most important structures in your entire cardiovascular system. The glycocalyx performs several critical functions. It creates a smooth, frictionless surface, allowing blood to flow without resistance. It prevents inflammatory molecules from reaching and attaching to the vessel wall, and it senses changes in blood flow and signals the endothelium to release nitric oxide, the gas molecule that keeps your vessels relaxed and dilated. When your glycocalyx remains intact and healthy, your vessels stay flexible and functional. But when it becomes damaged and breaks down, everything falls apart. Elevated blood sugar levels, chronic systemic inflammation, cigarette smoking, and oxidative stress strip away the glycocalyx, like acid dissolving a protective coating. Once it is gone, your vessel wall becomes exposed and vulnerable. Inflammatory molecules from your bloodstream attach to the endothelium. White blood cells adhere to the wall. LDL cholesterol particles penetrate into the vessel tissue. Atherosclerotic plaque begins forming. The endothelium stops producing adequate nitric oxide. Your vessels constrict, lose flexibility, and blood pressure climbs. Here is the critical point that I need you to understand. No blood pressure medication repairs the glycocalyx. ACE inhibitors do not repair it. Beta blockers do not repair it. Calcium channel blockers do not repair it. Diuretics certainly do not repair it. They manage the pressure reading while the underlying damage remains completely untreated. Your blood pressure numbers might look controlled on medication, but your vessels are still damaged, still vulnerable, still progressing silently toward a stroke or heart attack. This explains why people on blood pressure medication still experience cardiovascular events. The medication treats the symptom, but not the cause. The second mechanism is arterial stiffness and calcification, and most physicians completely overlook this. They focus exclusively on blood pressure numbers, but ignore whether the arteries themselves are stiff or flexible. That distinction matters more than the numbers. Research published in major cardiology journals has demonstrated through systematic review that arterial stiffness predicts cardiovascular events and all-cause mortality better than traditional blood pressure measurements alone. Your arteries should be elastic, expanding with each heartbeat and then springing back. But as you age, especially with hypertension, diabetes, or chronic inflammation, several destructive processes affect the middle layer of your artery walls. Calcium deposits begin forming where they do not belong. Calcium should be in your skeletal system, not in your arterial walls. But when vessels are chronically inflamed, calcium migrates from your bloodstream into the artery wall, crystallizes, and forms deposits that make the vessel progressively more rigid. Elastic fibers break down and are gradually replaced by collagen, which is stiff and inflexible. And smooth muscle cells undergo a pathological transformation, stopping their normal function and beginning to behave like bone-forming cells, actively depositing even more calcium and promoting calcification. By the time someone reaches 65 with poorly controlled hypertension, their arteries can resemble bone tissue more than blood vessels. They are calcified, rigid, and inflexible. And no blood pressure medication reverses this process. ACE inhibitors do not remove calcium deposits from vessel walls. Calcium channel blockers block calcium from entering smooth muscle cells acutely, but they do not remove calcium already embedded in the structural wall. The calcification remains, the stiffness persists. The third mechanism is nitric oxide deficiency. Nitric oxide is a gas molecule produced by your endothelial cells, and it is one of the most important signaling molecules in your cardiovascular system. When nitric oxide is released, it diffuses into the smooth muscle layer of your vessel walls and signals the muscle cells to relax. Your vessels dilate, blood flows more easily, resistance drops, and blood pressure decreases. Healthy endothelium produces nitric oxide continuously, keeping vessels in a relaxed state. But when the endothelium becomes damaged and the glycocalyx is stripped away, nitric oxide production drops dramatically. Vessels cannot relax properly. They remain constricted. Blood pressure rises and stays elevated. The enzyme responsible for producing nitric oxide requires several cofactors to function properly. The most critical is a molecule called tetrahydrobiopterin. When this molecule is adequate, the enzyme produces nitric oxide efficiently. When it becomes depleted through the same factors that damage the glycocalyx, elevated blood sugar, oxidative stress, chronic inflammation, the enzyme becomes dysfunctional and produces harmful free radicals instead of beneficial nitric oxide. Your body shifts from vessel protection to vessel destruction. The fourth mechanism is the insulin-kidney connection, and this one explains why reducing sodium intake does not work for most people with hypertension. Your kidneys control blood pressure by regulating sodium balance, but this system depends entirely on your kidneys being able to respond appropriately to sodium intake. Here is the critical problem. Insulin blocks sodium excretion from the kidneys.
When insulin levels are chronically elevated, your kidneys retain sodium, regardless of how much you are consuming. Insulin acts on the kidneys through several pathways. It directly stimulates sodium reabsorption.
It activates the sympathetic nervous system, triggering a hormonal cascade that results in aldosterone release, which instructs the kidneys to retain even more sodium. And it increases the sensitivity of your blood vessels to angiotensin II, a powerful vasoconstrictor. This is why people with insulin resistance, prediabetes, or type 2 diabetes almost invariably develop hypertension. The elevated insulin is locking their kidneys in continuous retention mode. And here is what most people do not realize. You can have significant insulin resistance without having diabetes. Your fasting blood glucose might be completely normal. Your A1C might be normal. But your insulin levels could be substantially elevated. And that elevated insulin is driving your hypertension silently. Most physicians never check insulin levels. They check glucose and A1C. If those are normal, they assume insulin is fine. That assumption is frequently wrong. Now let me give you the complete 4-step protocol to address each of these mechanisms. This is not theory. This is actionable biochemistry. Step 1 is restoring the glycocalyx. First, you must stop destroying it. The primary destroyers are elevated blood sugar and oxidative stress. Every time your blood sugar spikes above 140 after a meal, it damages the glycocalyx through a process called glycation. Step 1 is stabilizing your blood sugar by keeping post-meal readings below 140 consistently. For most people, this means significantly reducing refined carbohydrates, not eliminating all carbohydrates, but choosing ones that do not spike blood sugar dramatically. Whole foods, non-starchy vegetables, legumes, and moderate amounts of fruit. Avoiding sugar, white bread, white rice, pasta, and baked goods. Second, you must provide the building blocks your body needs to rebuild the glycocalyx. The glycocalyx is constructed primarily from molecules called glycosaminoglycans. The best dietary sources are sulfated polysaccharides from seaweed, specifically Fucoidan from brown seaweed. Research has shown these compounds can help restore glycocalyx thickness and improve endothelial function. Studies demonstrating benefit use doses of 600 to 1,000 milligrams daily. Third, you need to reduce oxidative stress significantly. The most potent antioxidants for vascular health are polyphenols from colorful vegetables and fruits. Berries, dark leafy greens, beets, dark chocolate, and green tea all contain compounds that neutralize free radicals before they can damage the glycocalyx. Step 2 is decalcification, removing calcium from your artery walls and restoring flexibility. Most people assume that once calcium deposits in arteries, it is permanent. They are mistaken. The key protein is called Matrix GLA protein, and it functions like a traffic controller for calcium. When properly activated, it directs calcium into your bones, where it belongs. When not activated, calcium migrates freely into your arteries. Matrix GLA protein is activated by vitamin K2, specifically the MK7 form. Research has found that high dietary menaquinone intake is associated with reduced coronary calcification. Without adequate K2, matrix GLA protein remains inactive, and calcium deposits freely in arteries. With adequate K2, the protein becomes activated, redirecting calcium out of arteries and into bones. Studies showing benefit use doses of 180 to 360 micrograms daily of MK7. But K2 alone is not sufficient. Calcium also needs vitamin D3 to effectively enter bone tissue. D3 increases calcium absorption and helps incorporate it into bone matrix. You need both working together. And the third component is magnesium, nature's natural calcium channel blocker. When magnesium levels are adequate, it blocks calcium from entering smooth muscle cells inappropriately and prevents calcium from crystallizing and forming deposits in vessel walls. The recommended dose for cardiovascular health is 400 to 600 milligrams daily of magnesium glycinate or magnesium threonate. Step 3 is nitric oxide restoration. First, protect the enzyme that produces it by ensuring adequate intake of folate from dark leafy greens, vitamin C from citrus fruits and berries, and vitamin E from nuts and seeds. These vitamins help regenerate the critical cofactor and prevent the enzyme from becoming dysfunctional. Second, stimulate nitric oxide production through shear stress. The most effective method researched for blood pressure reduction is isometric handgrip training. Squeeze a handgrip device at approximately 30% of your maximum strength for 2 minutes. Rest for 1 minute. Repeat 4 times. Practice this 4 days per week. Multiple clinical studies have demonstrated that this specific protocol can lower systolic blood pressure by 8 to 12 points after 8 weeks. That is comparable to the effect of some blood pressure medications, achieved through a simple exercise that takes less than 15 minutes. Third, practice nasal breathing. When you breathe through your nose instead of your mouth, your nasal passages produce nitric oxide. Research has demonstrated that nasal breathing increases blood nitric oxide levels by up to 400% compared to mouth breathing. This is a free, immediately available tool that supports vascular health with every breath you take. Step 4 is the insulin reset. This unlocks your kidneys and allows them to excrete sodium appropriately. The most effective method for lowering insulin is time-restricted eating. Condense all your food intake into a specific window each day and fast the remaining hours. An effective protocol is a 16-hour fast with an 8-hour eating window. Consume all meals between noon and 8 p.m. Fast from 8 p.m. until noon the next day. During the fasting window, drink only water, black coffee, or plain tea. No calories. Research demonstrates that time-restricted eating can lower blood pressure by 9 to 11 points systolic within 8 weeks without any change in what you eat, just when you eat. The mechanism is purely insulin-related. Lower insulin means unlocked kidneys, appropriate sodium excretion, and normalized blood pressure. You must also reduce insulin resistance at the cellular level. The most effective way is resistance training. When you perform resistance exercises, your muscles develop more insulin receptors. 2 to 3 sessions weekly can lower fasting insulin by 20 to 30% within 12 weeks. Now I need to address something critically important. I am not telling you to stop your blood pressure medication abruptly. That would be genuinely dangerous. Sudden discontinuation can cause rebound spikes in blood pressure and heart rate. Medication manages symptoms, while these protocols fix root causes. You need both initially. Start implementing these 4 steps while continuing your current medication. As your blood pressure improves over weeks and months, work collaboratively with your physician to reduce medication gradually under close supervision. Monitor your blood pressure daily at home. Track the trends. When your numbers consistently improve and remain stable, discuss medication reduction with your doctor. Never stop medication suddenly on your own. Never reduce doses without medical supervision. But do not accept the belief that you will need medication for life without exploring whether the underlying mechanisms can be corrected. Conventional management is pills for life. What I am describing is structural repair at the cellular level. These are fundamentally different approaches, and the research supports both being part of the conversation. Start with one step. Pick the one that resonates most with your situation. If you eat refined carbohydrates and sugary foods regularly, start with Glycocalyx restoration by stabilizing blood sugar. If you are overweight or have signs of insulin resistance, start with the insulin reset through time-restricted eating. If you rarely exercise, start with nitric oxide restoration through isometric handgrip training. One step, implemented consistently, can begin shifting the trajectory of your vascular health. Let me recap the 4 mechanisms and 4 solutions. First, glycocalyx destruction, addressed through blood sugar control, sulfated polysaccharides, and polyphenol-rich foods. Second, arterial calcification, addressed through vitamin K2, vitamin D3, and magnesium. Third, nitric oxide deficiency, addressed through protective vitamins, isometric exercise, and nasal breathing. Fourth, the insulin-kidney connection, addressed through time-restricted eating and resistance training. When you address root causes, blood pressure normalizes naturally. Not because you are artificially forcing it down, but because you have repaired the systems that regulate it. Your body heals itself when you provide the right conditions. If this video gave you a framework for understanding your blood pressure that goes deeper than the numbers on a monitor, please subscribe. I share new evidence-based content every week for seniors who want to understand the mechanisms behind their health, not just manage symptoms. And if someone you care about has been on blood pressure medication for years without ever addressing why their pressure is elevated, please share this video with them. I am Dr. Michael Williams. Thank you for watching, and I will see you in the next video. Take care of your vessels and take care of yourselves.